Hello, my name is Isabel Coronado. I'm a board member for the National Trauma Awareness Initiative. NTAI seeks to raise awareness around the national need for trauma awareness and trauma informed practices. The most impactful way to do this is by following the model the state of Delaware has set forth. Through executive action, the governor of Delaware has designated the state, all state departments, and all state agencies be trauma informed. NTAI believes that all states with benefits from becoming trauma informed. Becoming a designated trauma informed state means state departments and agencies will A. Develop a trauma informed care toolkit of resources that provide trauma awareness and self care education for state employees, increase recognition of signs of ACEs exposure, and offer effective interventions to mitigate trauma and build resilience to be shared across all state agencies and organizations for use at service delivery access points. B. Promote a trauma aware month held across the state. C. Share information with state employees and community partners on educational and professional development opportunities related to ACEs and building resiliency. D. Creating a recognition program for championing of this work, which may include individual divisions within an agency and community partners such as schools and school districts. E, identify gaps in available services or services capacity, along with the prevention and early intervention treatment continuum for children and their caregivers statewide. F, developing a comprehensive plan focused on early intervention for children and their caregivers' exposures to adverse childhood experiences in order to help prevent abuse and neglect and remedy the impact of it. G, coordinating the collection, evaluation, and reporting of ACEs data. Number two, all state agencies that provide services for children and adults will integrate trauma informed best practices, which will include, but are not limited to, A, offering regularly scheduled trainings to staff to increase their knowledge about the impact of ACEs and toxic stress on short term and long term health outcomes. B, promoting strategies to enhance staff resiliency and self care. C, using trauma specific language in requests for proposals and M service contracts with providers when appropriate. D, implementing evidence informed services to prevent and respond to toxic stress and build resiliency in children, adults, and communities. NTAI seeks to provide technical assistance and training to stakeholders that believe in this mission. The Kaiser Permanente Adverse Childhood Experiences, ACEs, study identified that childhood exposure to traumatic experiences increased the likelihood of physical and psychological illness later in life. Those childhood experiences are physical, emotional, or sexual abuse, physical or emotional neglect, household dysfunction, including substance abuse, untreated mental illness, or incarceration of a household member, domestic violence, and separation divorce involving household members. And a study published in September 2018 in the Journal of the American Medical Association Pediatrics, the largest ACEs study ever conducted, sampling over 200,000 adults across 23 states, documented that 25% of the respondents reported exposure to three or more ACEs, and 16% were exposed to four or more ACEs, with higher exposure noted among people of color, those who identify as gay, lesbian, or bisexual, those of lower economic means, and those with less than a high school education. And a recent study by the Center for Disease Control and Prevention found that the average lifetime cost for each victim of abuse and neglect was $210 and $12, including child and adult health care costs and productivity losses. The lifetime cost associated with just 1 year of confirmed cases of childhood maltreatment was approximately $128 billion. And research has shown that prevention of prolonged exposure to toxic stress, early intervention, trauma specific treatment, and building resilience of children and families. We ask you to join us in the fight to raise awareness around trauma awareness. If you are able to partner in this initiative, please send an email through our contact page. Thank you.